If you have persistent popping at your hip that occurs with certain motions, you know how annoying that can be. The good thing that you should know is that it generally does not mean that there's something wrong with the structural components of the hips. It does, however, mean that you may have some of the muscles involved that are snapping over other structures, causing and reproducing that popping. Internal based popping involves the front portion of the hip flexor, so involving a muscle called the iliopsoas. External based popping either involves your IT band, which runs along the side through here, or the gluteal muscles. Based upon the type of popping that you're having and where you feel the popping, that determines what approach you should take when it comes to strengthening. So, popping that involves more of the front side of the hips, we're going to focus more on your hip flexors to help strengthen that area a bit. And popping that occurs on the back side or more so external base, may feel it more so through here or here, we're going to focus more so on your glutes. However, it is important to make sure that in general that you're strengthening the entire body. So don't just focus on just one side versus the other. Focus on both sides of your body and all muscle groups involving the legs. These exercises are more so just to give you targeted things that you can do specific to the sensation that you're feeling. And before we start, I just want to make sure I emphasize that popping at the hip does not mean that there's something going on that is wrong. It more so is just annoying, and generally speaking, you can make activity modifications to minimize that from occurring, and also you can do some strengthening activities to help decrease the occurrence. However, if the occurrence remains and you're not having any pain or any limitations with the activities, don't be alarmed. Just know that it is a normal variation, but it is a bit annoying. First, let's talk about popping at the front of the hip. This normally involves a muscle group called the iliopsoas muscles, which helps to flex the hip. Let's go over a movement that you can do to see if you can reproduce your hip popping. You're going to lay flat on your back with both legs straight, and then you're going to bring one leg up towards your chest and gently rotate it out to the side. After you bring that leg back up and rotate it inward, that may be when you feel the popping. If you notice popping with that, then let's give some hip flexor strengthening exercises a chance. First, with that same position, you can gently bring your knee toward your chest to do a marching hip flexion. With this one here, you want to make sure that you are not overly gripping through your abdominal muscles. If that supine march is too easy, you can progress it by using a band. With the band, place it around your feet, and now adding that tension as you pull the leg up, you should feel increased activation of the muscles. The tension of the band will determine how challenging this exercise is for you. For the next hip flexor strengthening exercise, now you're going to keep the knee straight. You're going to squeeze your thigh muscles to help maintain that knee extension, and now lift your leg up, bringing your foot towards the ceiling. This here is going to activate the iliopsoas muscles and also your rectus femoral muscles, both which are hip flexors. You can progress the exercises that we just did to a standing position, which will be more functional. Not only will you challenge your balance, but now you'll be working against gravity in a different way. You can even add in the band at the feet to allow for additional resistance. Now let's address the external hip popping, which often involves the IT band and or the gluteal muscles. It is felt at the back or the side of your hip. In order to reproduce the popping in this region, I want you to lay on your side. You're going to start off first by bringing your foot in front of you, keeping the leg straight on top, and then bringing the leg back behind you. As you bring the leg back behind you and transition coming forward, that is when you may notice that hip popping. In order to address popping this region, we're going to focus on strengthening the gluteal muscles. You can start off with a simple bridge. In order to progress the bridge, you can do numerous things. One thing that you can do is hold a weight at your pelvis as you gently squeeze your glutes to lift your hips and your pelvis from the ground. Another progression you can do for a bridge is doing a single leg bridge. With this activity, you want to make sure that you push with just one leg, but maintain the pelvis in a level position. Now we're going to take it to standing and do some lunges. Lunges are not only a good way to strengthen your quad muscles, but they can help with gluteal strength as well. As you're doing lunges, there are different progressions that you can do. One progression is simply adding weights. As you add weights, the focus is to maintain a torso in a erect position and also keep pushing up. You can also add a step in, whether the step be with the front leg or even the trail leg. Another popular exercise to help strengthen the glutes and the hip extensors is a deadlift. You can begin with no weights with this activity, simply hinging at the hips, keeping the back straight. When progressing from double leg, you can even try single leg. With this one, if you notice your balance is off, it is okay to use one arm to hold on to something to help maintain your balance. In order to further progress it, you can add weights. I recommend that you move back to doing double leg when you add in the weights with the progression. And then, as you feel more comfortable, now you can progress to a single leg deadlift using weights. So let's do a quick recap. If you feel popping at the front of the hip, then start with some of the exercises we did in the beginning for hip flexion. If you feel popping at the side or the back of the hip, then focus on gluteal strengthening and moving into hip extension. Just because you have popping doesn't mean anything is wrong. Unless you're having pain or noticing other symptoms, it may not be anything that you should worry about. But for now, give these exercises a try and let me know how they work out for you.